New research shows that kidney disease is taking a serious toll on patients' mental health. They often need up to 3 or 4 hour weekly dialysis sessions, causing huge disruptions to the way of life. Now, 9th of March is World Kidney Day, and a recent survey by Kidney Research UK shows at least 2/3 of patients suffer from depression to thoughts of suicide. To discuss more on this now, I'm joined by Dr. Karisha Quarrie from Life Healthcare. She's the clinical directorate, or with the clinic operations manager for the clinical directorate there. Dr. Quarrie, thank you so much for your time. Obviously, this research coming out of the UK, but kidney disease is almost one of those silent killers, if I pardon me using that term, but it is a disease that I feel not enough emphasis is put on, specifically here in South Africa. In terms of chronic kidney disease, how bad are the numbers here in South Africa?
Thank you very much, Marcella, and thank you for inviting me to speak today. When it comes to kidney disease, or specifically kidney failure or renal failure, the numbers are actually unknown, and that is because it goes largely undiagnosed until it's too late and we get to an end stage of kidney disease. So the incidence across our country is actually unknown, but the burden of disease in South Africa is quite heavy on our healthcare systems.
Why is it that this is something that almost goes undiagnosed?
Yes, it's because the symptoms are quite subtle. Symptoms include things like fatigue, swelling of the hands and feet, frequently urinating at night, erectile dysfunction in males, and many people will experience this over the course of their lives and will not seek out medical assistance. And that's why it goes largely undiagnosed or diagnosed only at a late stage. And the challenge is that a disease can impact the kidneys and only become evident many months or years later in the form of kidney failure. And that's why it's such a problem in our country.
What do you believe would be the best way to try and raise awareness or increase education around what people should be looking out for if they fear kidney disease might be an issue?
I think the first step is definitely to know what your risk factors are, and that is for the health authorities to ensure that patients or individuals understand what these risk factors are. And these include if you've got diabetes or hypertension, heart failure or heart disease, if you are obese or overweight, if you're a smoker, if you have any history of renal disease or kidney failure in your family, then there should be an awareness that that individual needs more investigation for kidney disease and to lead a healthier lifestyle.
Like you said, often when diagnosis finally takes place, we're dealing with a kidney disease that's already advanced, and the treatment, the burden of treatment is quite heavy already at that stage. You're talking about dialysis treatment, and the list goes on. And what's been raised on during this year's World Kidney Day is the impact that that has on your mental health. How much of the care of those suffering from kidney disease focuses on how to manage the mental health impact that their diagnosis may have?
Thanks. Yes, mental health is an important aspect, and it's only recently been considered an important part of the holistic care of a patient with kidney failure. Across our 31 renal care units, we are starting to introduce care coordinators, which are individuals that help the patient through the psychosocial aspects of their disease. As you can imagine, if you're coming into a hospital 3 to 4 times a week, or a renal unit 3 to 4 times a week for your dialysis, it's going to disrupt your personal life, your work life. It's going to impact your finances, and also facing a disease that has the potential to, along the line, kill you, creates a lot of anxiety, depression, and, as you mentioned earlier on, self-harm events in patients who have chronic kidney disease. And so it's important that we start to understand this for our patients, and we provide the necessary holistic care, which includes mental health services.
Obviously, prevention is key. And how much of that is to do with lifestyle? In the decades of one's life where your health is maybe not top of mind, your 20s, your 30s and your 40s, where you really should be taking care of what you put in your mouth, getting enough exercise and that kind of thing. How much of that can at least put you on the route to avoiding any kind of kidney disease?
Yes, so any positive lifestyle changes, as you've mentioned, including limiting and stopping smoking, alcohol, or the consumption of any kind of drug or poison, as well as taking medication that is not prescribed for you. You should not be doing that. And individuals really, as you've said, need to take control of and responsibility for their health in their earlier years, so as to prolong their life and prevent the onset of any disease that can contribute to chronic kidney failure. And it's also important that if you have a chronic disease like diabetes or hypertension, to make sure that you adhere to the treatment protocols and medications that have been given to you or prescribed by your doctor, and to stay on track with your hospital and doctor visits. That's extremely important.
Some good advice to end on. Thank you so much, Dr. Karisha Quarrie. She's the Operations Manager for Clinical Directorate at the Life Healthcare. Thank you for that little bit of much needed information and advice as we take care of ourselves today on World Kidney Day.